Good afternoon, everyone, and welcome to today's webinar titled Building Evidence Use into Business as Usual for Service Improvement. I am Pascal Navele, a research practitioner with Lambeth Council Health Determinants Research Collaboration, often referred to as HDRC team, and I will be your moderator for this session. We are delighted to have you join us for what promises to be an insightful discussion on embedding evidence into everyday practice in health and social care. Before we start, some few housekeeping. The webinar will run for 60 minutes and will be recorded, and the recording will be shared after the webinar. Professor Annette Boaz will speak for approximately 30 to 35 minutes, followed by questions and answer session. Please feel free to submit your questions in the question and answer button at the top corner of your computers. The speaker will respond after the presentation. Now it is my pleasure to introduce our speaker, Professor Annette Boaz, Professor of Health and Social Care and Director of NIHR Health and Social Care Workforce Research Unit at King's College London. She has over 25 years of experience supporting the use of evidence across policy domains. She co-leads Transforming Evidence and advises the World Health Organization on international projects, and is an NIHR senior investigator. Her work spans across government, academia, and global health policy, and she is the author of What Works Now, a very interesting read. So for those of you who haven't had the opportunity to, you are encouraged to do so after the webinar. Annette, thank you so much for joining us today. The floor is yours.
Thank you, Pascal. Can you see my slides okay?
Not yet.
Okay, let me make sure that that is definitely working. Okay.
Not. There you go.
You can see those now.
That's correct. Thank you.
Okay, so thank you very much for the invitation to come and talk to you today. I'm really looking forward to the conversation afterwards. And as Pascal said, I've been working in this area for quite a long time now, but first started out thinking about evidence use in policy and practice through a program called Better Government for Older People that hopefully none of you are old enough to remember, but it was a program that was set out to improve the use of evidence around dealing with an ageing population across a whole range of areas. And that involved lots and lots of work with local authorities around the country, and has really informed my thinking about evidence use throughout my career. I'm going to start by sharing some of the learning about where I think we've got to with thinking about evidence use as business as usual to help us with improving services. And hopefully we can then carry that on into a conversation together afterwards. So one of the strongest metaphors really for thinking about evidence use, and certainly something that's dominated researchers' thinking, is this idea of a kind of research pipeline where researchers are busy in universities producing lots and lots of evidence, and then they push it down this pipeline and it appears on your desk in a local authority, in an organization, and you pick it up and faithfully use it to inform your practice. And of course, we know that that isn't really what happens with evidence, but it's still quite a dominant metaphor. And whenever people come into this field afresh, this is the metaphor that they're most likely to be carrying. In reality, we've grown to understand that actually getting evidence into use is a really complex process. It's not just about that kind of very linear model, although that's still important. It's still important that we're kind of pushing out our outputs and making sure they're available to people. But it's also really relational work. It's about the skills and capacity we have as decision makers, as researchers, as analysts within organizations. It's about the skills we've got to do the work we need to do and how we can use research as part of that work. And it's also about building systems to support us in that work as we do it. So if we don't have systems that provide us with things like strategic leadership, rewards for using research in our practice, and also kind of things like infrastructure, so investing in specific posts and that's something that the HDRCs, for example, have been able to do. Then with all these things together, we can really see evidence use as becoming much more business as usual in organizations. Without any one of these elements, it's going to be really an uphill struggle. But typically we've carried on with the work that we do as researchers, focusing in on that linear work, a little bit on the relational, and much less on the systems work. So this was a mapping of organisations in the UK doing work to support evidence use, and this is just showing where the work very much lay in that kind of linear and relational elements, and much less addressing these kind of tricky systemic issues that need to be there to support us when we use research evidence. So one of the challenges, and why we maybe haven't moved forward as much as we would hope to in this area, is there are many different ways of kind of writing, thinking, conceptualizing the relationship between evidence, policy, and practice. And this is written about by different people, different parts of the world, using different framing, connecting with different spheres of practice. So, for example, implementation science has been very kind of clinical and used by our What Works networks in the UK. Whereas in the US, they have this work on what they call the use of research evidence, which is really orientated towards kind of social policy, children's services, some mental health areas. And in Canada, there's been a push towards thinking about knowledge transfer and research uptake. And more recently, we've all picked up this idea of knowledge mobilization. So lots of different framing, lots of different literatures, and inevitably that feels like a bit of overload. And so what we end up with is new fields like meta science, which is the latest one, where we kind of reinvent all this work and start again. So not helpful for those of you in the business of trying to use research in your practice. One of the big shifts I think we have managed to achieve is moving away from this idea that we have evidence-based practice to evidence-informed practice. So growing recognition that policy and practice aren't going to be built on research directly, but the research can shape and help and be one of the influences on work that's done, but it won't be driving it necessarily. It's unlikely to ever be the kind of single factor that makes a difference. And that sounds really obvious, but it's taken a long time to get to this point where we recognise the need for kind of evidence-informed policy rather than that idea that you're pushing an evidence base. So there's lots of terminology used in this area. I just wanted to flag some of the key terms. The sort of traditional term is knowledge transfer. So this is really sort of helping people make sense of research we've done already. So summarising it, adapting it, sharing it in ways that are easier to kind of understand and apply, and also setting up systems to make it easier to find as well. So really important issue about how you actually access research and where it's kind of made available. So that kind of KT movement that was really big in Canada, and we've done some of here, is quite in that kind of first category, the linear category. It's really about getting evidence together and pushing it towards those who might use it. Thinking about things from the other perspective is the idea of evidence-informed policy or evidence-informed practice, which starts much more with the decisions and the policies, but the idea that those decisions and policies would be guided by the best available evidence, and there would be transparent and systematic processes in place to support that. So starting in this perspective much more with the decisions that need to be made, the tasks that need to be undertaken from a government perspective, and making sure evidence can be useful to that. And then we talk about knowledge mobilization, and what the difference here is this idea of really recognizing the importance of an active collaboration between those who produce research and those who use research. So kind of using a model of key stakeholders, working with them throughout your research, including people potentially working in practice in the production of research, and sort of really sharing that journey together of integrating research into practice, recognizing the value of the knowledge practitioners themselves and people with lived experience bring, and reconciling and drawing those together to be helpful to policy. So this is a kind of different model, a much more engaged model. And this is the approach that NIHR, one of our main funders, in health and social care, this is the definition they use at the moment from this kind of menu of 3. I just wanted to recognise that we've been thinking about this issue in this area for a really long time. So this is a book back in 1972 or 3, I think, produced in America. It was a sort of ethnographic account two researchers did, where they went and lived in a government and they observed how research was used within that environment. And this is a book called Implementation, so a great read, but it really was sort of recognizing the complexity really of evidence use from a systems perspective, rather than from a research push perspective. Another step forward I think we are gradually making is a recognition of the importance of all types of knowledge and evidence to decision making, that it's not just about the research and it's not just about specific subsets of research, such as randomized control trials, cost effectiveness analyses, that actually to address the problems we have in our society, we need to be drawing on a wide range of evidence drawn from all kinds of different sources and different perspectives and people, so that we're recognizing here the importance of lived experience, of organizational data, and also the kind of expertise of professionals that they carry with them in the work that they do. So seeing this kind of much more sophisticated and complex pie chart of the different sorts of evidence that's used, and this is produced by Foundations, the Work Centre for Children. And we did a piece of work for Sky more than 10 years ago now, where we also we did a similar typology of types of evidence, but we also argued that we must recognize that there is no hierarchy in terms of quality here, that these are all important perspectives to bring together when we're making decisions about policy and practice. And there is no sort of putting one of these types of evidence above others, that they all contribute to our understanding of what we need to do in terms of implementation and change. So a really important development of moving away from thinking about particular types of evidence as having a kind of priority over others, to a recognition of this kind of much more mixed picture. So I wanted to talk a little bit about some of the more recent developments in this field. So moving away from a very conventional academic model where you get some funding and you produce some research, and at the end of the day you go and ask people to read it. This was an approach funded by NIHR in the social care space to fund 6 brand new research practice partnership collaborations. And the idea here was to build more mutually beneficial collaborations between people using research and people doing research, where they identified priorities together, built trusting relationships, and sort of also supported capacity building of researchers, but also people in local authorities and in care homes and other care providers. Use models like research champions and embedded researchers to build a kind of really rich environment where research might flourish and be useful to service delivery organisations. So this was a significant programme of work, which was about building really that kind of research system and research cultures in organisations to make it possible for that research to actually not just be funded and conducted, but actually to be used within the organisations. I'm just going to pull out one of the partnerships, which is the one that we've worked on at King's. So we set up 3 brand new research practice partnerships, one in Newcastle. So that was a partnership between care homes, a small group of care homes, and Newcastle University. A partnership in Chester, which was a partnership between a local authority and local government and the university, and Lancaster, which was a partnership between a university and a local kind of local and national really care providing network. So 3 different partnerships, and we've evaluated these partnerships over time. So one of the things our design colleague has done is produced a kind of a cartoon strip talking through our partnership work, and to say a little bit about what we did. So we started off like diving into what's actually a kind of large literature on working in a partnership format between research and practice. So we looked particularly to the US, where they've built these really strong, long-lasting partnerships between particularly the education sector, but also in some other spheres. And these have been really powerful partnerships. And for example, when the pandemic came along, these were partnerships that could immediately be used between local authorities to ask really difficult questions they wanted to ask the research community, but they had these trusted partnerships so that they could go and say, we really need to know about how we're going to feed our local population, for example, during this difficult time. So we looked at all these different literatures from elsewhere. So we looked at partnerships in Finland, in Australia, and also in Canada, and tried to learn what we could about what seemed to work in these partnerships elsewhere. And then we sort of mapped out what the partnerships looked like over time in these projects, what they put in place, what made a good partnership. And we drafted some principles, which I'll show you in a minute, about what we thought made for a good partnership activity at the start. We then turned our attention to the social care sector, and the question we were asking was, could you bring this partnership model into a very different sector like social care? It's actually really resource constrained, so with low pay, language barriers, high staff turnovers. Could we make this partnership model work in a social care environment? So we talked to lots of experts in the sector, people with lived experience, and we ran some co-design workshops between the social care experts and also the international partnership experts. And we also consulted with social care staff, patients and clients. So from that, we came up with a list of principles which we thought were really important if you were going to work in a partnership. And these included respect, equal collaboration, partners trusting each other, grounding the work in current issues. So this is really important. It's about identifying priorities that really matter to the local community, not researcher priorities, bringing in the expertise that were needed for the partnership, recognizing that the partnership would evolve and iterate, change over time, thinking about the different ways we could invest. So this wasn't just about money, but investing kind of time and goodwill and leadership, providing a kind of safe and supportive environment for some of the difficult issues. So, for example, there's a partnership that's been working in America where they've been looking at issues around kind of bullying and truancy. And these have been really difficult issues for the partnership to deal with the schools. Trying to build this idea that the partnership is owned by everyone. So it's not a researcher-led initiative and it's not a care provider or a local authority-led, it's a shared endeavour. And that everyone is in it because they wanted your research to be useful for real-world change. So then we recruited through a competition 3 sites, so the 3 I mentioned earlier, and we set these partnerships up. We provided them with design support to get going. We provided them with implementation support over time from research in practice. And we also had an evaluation team from the London School of Economics who observed the partnerships and also interviewed everybody involved. And we collected some tracking data about the activities of the partnership as well. And building partnerships is not easy, as many of you will know from the partnership work that you're involved in. And it wasn't any different for our research practice partnerships. So this is showing their progress at 3 stages over a 3-year period. And as you'll see, they all started off from a reasonably similar starting point. So these are 5 dimensions of effectiveness they're mapped onto. And one of them sort of grew steadily. One of them has grown more substantially. And one of them didn't really grow and develop at all and had actually terminated before the final time point. And we've learned as much from the partnership that didn't work as from the 2 that have had more success. So we've really learned about this journey that partnerships go on and all the stages along the way. And we hope that there's some real insights here, which we can talk about afterwards about the partnership working. One thing I'd flag, for example, about funding is that this partnership working wasn't particularly expensive in the traditional sense that research can be expensive. A lot of the projects that the service organisations were interested in were actually quite small scale. For example, having some help with their own internal data to understand issues, which the researchers were happy to do. One of the care home partnership, for example, wanted to do some work around attitudes among staff and patients and residents towards wearing uniforms. And so this was a relatively small scale project. Elsewhere, they've leveraged in other resources to get pieces of work done. But the funding, the small amount of funding the partnerships did have, had a symbolic value because there's something about having some resource and some investment that shows that people feel that what you're doing is important. So we did have this sort of tension between the work not being very expensive, but needing some support, and also this kind of partnership level research being quite hard to resource. It's not necessarily about big internationally impactful studies. It's about research that matters to the local community and to the local organisations. And there's quite a mismatch there between those different types of research and where you might get funding to do the work. But we did see incredible capacity building in the organisations. lots of investment in people to develop research skills, but a real need for the organisations they were based in to be able to use those new skills and capacity. And then another interesting finding was about how the partnerships need to be really rooted, anchored in all the organisations. So it's very tempting with this kind of work to just have a couple of people who do the connecting and to call it a partnership. But you need these partnerships to be really anchored in with multiple points into an organisation, not just individuals across different organisations speaking to each other. So I wanted to just mention one other systems lever, and this comes back to the issue I mentioned earlier around the importance of prioritisation. So we have a mandate at national government level in the UK for all government departments to produce what are called their areas of research interest. So you may have heard of these already, but each government department has to publish and regularly update its areas of research interest to communicate to the outside world. So what research would be helpful to them as the Department for Work and Pensions, the Department of Health and Social Care, the Department for Education. So what they have to publish those, and they work hard to share them around. This has been proved to be a really interesting mechanism for engagement, not just outside of government, so to help governments engage with research communities, but also across government to see those shared interests. And we're increasingly seeing now local authorities producing their areas of research interest. And that's also showing some shared interest between central and local government, but also between different local authorities. And this has all been facilitated by the Areas of Research Interest database. So that's the ARI database. And you can look at that and find out, put any topic you're interested in, and it'll tell you what government departments and what local authorities are interested in that area. So it's a great mechanism to allow us to explore these connections between the shared interests of government, and also for external researchers to see what government's interested in, and also for funders to see what areas they might put funding into to support central government and hopefully also local authority research interests. So these are those systems sort of levers that we can see that support all this individual goodwill you see in brilliant individuals who work really hard to support research use. These systems levers can really help to take that to a different level by enabling and supporting and stretching those activities further. So I just wanted to flag, though, that what this work is doing is sort of providing opportunities and creating opportunities for a whole new cadre of people who are doing work at the boundary between, say, a local authority and the community, the local authority and government, the local authority and academia. And so this is the kind of space that the health determinants research collaborations and the applied research collaborations, the ARCs, are working in. So these are two big NIHR investments, and they're absolutely about trying to mobilize evidence for use. And the people who do that work, who are sometimes called intermediaries, sometimes called knowledge brokers, sometimes called boundary workers, are working really hard and have a very specific set of skills to do that work that's often overlooked or underrated. But the key criteria for me is they have a lot of humility. Like, to be working at the boundary between different types of organisation, you have to recognise that you do not know it all, and you need to be listening to the different types of expertise people have around that pie we were looking at earlier, the different kinds of knowledge they bring, and helping to bring that together in a useful way for an organisation. So is all this work turning our use of research into business as usual? Is that going to make a difference? Well, that's going to be very hard for us to study in local government, very hard for us to study in any area outside health where we don't invest in research to the same extent. But where we have internationally invested massive amounts of money in building healthcare organisation infrastructure to support research use. So this is a systematic review that we undertook of all kinds of research engagement opportunities that have been done internationally to support the use of research in practice. And what we can see in health is where you have this investment, not only do you get better processes of care for patients, you also get better outcomes for those patients. So a really strong picture of a positive message here, that building up this kind of research capacity in organisation, these research systems, is going to lead to a healthier and more effective organisation. And what we see is something the academics working in this area describe as a dose effect. So the more you do, the better the outcomes you get for the people using your services. And what's really interesting in this literature is that people have worked really hard at that equity angle. So making sure this benefit of research engaged organizations doesn't just go to the same people as you might expect, but has an equity dimension. So it reaches out to targeted populations. So the way that they've done this, for example, is making sure that organizations that aren't so research engaged in healthcare systems are brought in and connected as part of networks into this kind of wider culture. So a really positive message here about what you can do if you engage in building this business as usual model of research use. Another positive development is that there's now a global research agenda in this area. So this has 19 priority research areas that have been developed over a really extensive international collaboration led by the World Health Organization. And what this says is the kind of areas we need to understand more. So we need to understand more about the kind of interventions you might need to put in place. So is a knowledge mobilizer the best use of your money? Or are you better to, spend more money on improving communications of research findings? It's interested in barriers and facilitators, and as you'll see, number 3 there comes back to the importance of integrating diversity, equity and inclusion into the work we do on KT. And we've actually used this in the UK to set up a NIHR incubator that's focused on knowledge mobilization for research inclusion. So to absolutely take this topic as we focus our attention on knowledge mobilization in the UK to making sure we do that with a diversity, equity and inclusion lens, really critical area. And they've also mapped out some of the kind of methodological work that people might be interested in too. So a really important kind of global marker that this is an important area that we should be working in. So I wanted to just finish with what feel like the new developments in the field. As I mentioned, this interest in equity and engagement is really important. So seeing knowledge mobilization as something that should be done to build research use and be done in a way that is really conscious of doing it for everyone. It's connecting together the growing research infrastructure. So by that, I mean things like the health determinants research collaboration that is a big part of Lambeth. Also the applied research collaborations, our incubator for knowledge mobilization. So really making sure we connect and make the best use of this investment and connecting to non-NIHR investments like the research engagement networks funded by NHS England. So just seeing a bigger picture that we can connect and get the better than the sum of the parts, recognizing and supporting and evaluating these evidence use initiatives so we learn from what we do. So at the moment, if you ask me what was best to spend your money on, I wouldn't be able to tell you, and hopefully in 5-10 years time we'll really be able to say build a network, set up a partnership, invest in some knowledge brokers, set up a new knowledge management system, and these are the relative benefits you'll get. Recognizing that research to tackle complex problems is going to mean mobilizing lots of different types of evidence. I think we've really made some progress there. More difficult incentivizing academics to do this kind of work, and knowledge mobilizers, knowledge brokers really point to the lack of incentives for people like them to do the work that they do and also build kind of their careers. And actually thinking about the growing interest in building policy and practice systems to support research use. So what do we need to do going forward, and how are we going to do that? And finally, as we said earlier, appreciating these diverse types of evidence that are needed to support policy and practice. If you're interested in knowing more around this area, have a look at our Transforming Evidence website. It's full of blogs and resources, including there'll be a link there to the Areas of Research Interest database, and also just lots of forewarning of events in this area. But please do get in touch and engage with us, because what we really want to do is support some learning here rather than that wheel of different types of approaches spinning out of control and no one knowing what to do. So I'm really interested in spending some time now hearing your thoughts and answering some questions. Thank you very much.
Thank you very much, Annette, for that insightful presentation. We'll now go into our Q&A session. Please keep your questions coming in the Q&A button. I'll start off with a couple of questions, and then we can pick those ones in the chat. So in moving from linear models of evidence use to a complex systems approach, what are the first 2 or 3 behaviors you would expect to see change in a local authority or provider organization? And how can leaders make those changes take beyond a single project cycle?
Yeah, so that's a great question. So I do think we often get very caught up in doing more and more things to support that linear model. So putting in place really nice systems to, make sure we share documents around organizations, and that's all really important. I think that first step is in that relational step. So Bev Holmes, who came up with this, the move from linear to relational to systems, talked about it as 3 generations of thinking. So that we need to go through that stage of thinking about the people, the relational work that goes on, recognizing and rewarding, for example, people participating in research networks and connecting with others. So thinking about the people and then moving on to think about what are some of the systems barriers we need to address, what are some of the challenges here to making this work happen. So, and never forgetting about the importance of the linear. So these are not stages that replace each other. We're building from the linear, we're building the relational work around it, and then we're building the systems to help it all work better.
Okay, fantastic, thank you. I'll pick a question from the Q&A button. Annette, your slide on building capacity talked about being a research ally. Can you say a little bit more about that idea?
Yeah, that's a great question. So one of the things we do, there are lots of things we don't know about supporting the use of evidence in policy and practice. One of the things we do know is how critical, as with any process of change, leadership is. It's really important that we have people who advocate for this work at the highest level. What Research Allies alludes to, though, is a kind of the support you need at all different levels. This is not just about high-level leadership, but you also need people who are prepared to be a real ally for research. And this is about just giving some support and standing alongside people doing this kind of work and making sure they're given the space and time to make it work. So it's a kind of something that's very doable and very practical. And it very much emerged out of the partnership work that we did, that having allies for work really helps to make things happen in a whole different way and is not resource intensive, but it's about mobilizing the people you have around you.
Okay, thank you. I have a couple of questions here as well. Could you please tell us more about what attributes you think knowledge brokers need to operate effectively? Humility and relational practice being central, but what else?
Yes, I think this is really important, isn't it, to thinking about what people need. I mean, I often talk about curiosity. So people who are knowledge brokers often need to be interested in what's going on in different organizations because they're going to be trying to help research be useful to those organizations. And being curious helps you kind of see a value in that, that you're wanting to learn and constantly be learning. There's quite a lot of creativity involved because you're often having to try and find solutions and put people together. And there's also quite a lot of sort of need for people to be sort of resilient, really, because this is tough work and it often takes quite a while for the work you're doing to make a difference. So that kind of resilience, curiosity and creativity are things that I often would look for in knowledge brokers. And that humility I mentioned, probably the most important thing.
Right? Can you tell us more about the 3 collaborative groups and the group that terminated in the end?
So what was interesting in the group that terminated was that the partnership, so it almost failed from the another way round than usually happens. So the non-academic partners had a really clear idea what a partnership was, and it was they were a sort of semi-commercial organization, and they had a kind of quite a business model of what a partnership was. And that didn't really align with the work that was being undertaken in the partnership. So they kind of felt disappointed that they weren't getting what they wanted out of the partnership. And then the partnership between the university and the provider didn't ever really evolve to something that felt like a partnership for any of the stakeholders involved. Another challenge the partnership had was that the sort of the provider organization sort of treated the university like a free consultancy service. So they were expecting them to do work in some of the positive ways of consultancy work so quickly and very efficiently, and not always what universities are best at. So there was some disappointment in terms of them not understanding what each of them was bringing and how they could work together, and never really evolving to that sense that they were a kind of really effective partnership. And then the people who were engaged in the partnerships from the organizations weren't necessarily the right people. So in terms of the key person who was in the university, for example, didn't have a lot of kind of power and influence and agency or allies in the organization to help her do this quite difficult work of setting up the partnership. She was relatively new and she sort of didn't really know her way around the university and have those kind of allies she needed to make it work. So that was the failed partnership, and there was just no trust there. So by the end, there wasn't the trust that was needed to carry on working together. Whereas the other two partnerships worked really, particularly one of them worked really, really hard on building trust. So they would never make any decision without making it together as a partnership, and really worked hard to do in the first year of the partnership, what supermarkets will call a loss leader. So something that was just going to make everyone feel like the partnership was going in the right direction, a project everyone was really enthusiastic about. So they just really thought about what it meant to kind of build and engage. But I would say these partnerships have taken a long time to get going. This is not something that happens in 6 to 9 months. This is you're really investing in building a long-term relationship, and it's another bit of infrastructure to support research use. So you're building up something that is going to be, really pay back to you in the long run, but isn't going to deliver straight away.
Yeah, we have two questions here. First, sometimes we hear from communities that don't feel that their feedback has been taken on board through previous engagements, and so may be reluctant to engage if they don't feel their feedback was previously considered. How can we best serve communities, manage expectations, and share knowledge to support better engagement?
Yeah, I think this is a really important problem for partnership working. And, I think we've all been, made this mistake before. We often do, in fact, frequently use feedback that's given to us, but we don't think to go back and tell people what we did with it, which is why the "you said we did" mechanism is so important to actually tell people the work that you've done with their input. I mean, we were really surprised that our own public contributors group for our research unit didn't think we used their input, because we use it all the time. And so we had to put in place a system to make sure that we gave people feedback to tell them what we'd done with their input. So it's a sort of a cycle of feedback that we need on the back of asking people's views, so that they know what's happened as a result of the input they've given. That's a really critical thing. And I think it's important not just for the time somebody's given in one particular project, but as you say, it creates problems for the long term. If you haven't shown people how you use their feedback in your work, it makes them less likely to want to engage in the future. So it has long-term consequences as well if we don't give that feedback on how we've used people's input, or haven't, and get input on why we haven't used it as well.
Fantastic. You talked about some of the challenges of aligning research priorities, for instance, between academic organizational partners. It's a challenging one. Where have you seen examples of this done well?
So identifying and building priorities is a kind of long-term process. One of the advantages of it is that you learn a lot going on the journey together, learning about different priorities that different groups have for an organization and for the areas in which they live. And so it's not just about where you get to, but some of that learning you get along the way as well. So research prioritization is quite an under sort of explored area for things like partnerships and for generally for the work that we do. And I think we need to do it better and understand better how we can do really good research prioritization. I mean, academics typically often fall back on their own priorities rather than reaching out and finding out what others are interested in. And one of the things we found really in the partnership work that's been done in the UK, so for example, one of the care partnerships run by some colleagues up at Leeds University, is to be really surprised by some of the things that the care homes they work with wanted to do work on. So, for example, they've done a big project around kind of dental care in care homes and put issues on the agenda that weren't necessarily there before. So really critical for making sure we set the research agenda to things that really matter for all stakeholders. And also we get some benefits from having that process of prioritization together in terms of understanding where everyone's coming from.
How would you recommend getting from areas of research interest to identifying specific research questions that can be addressed and meet the needs of stakeholders?
So that is a really good question because, as that question suggests, areas of research interest aren't research questions. So they're topics that help people to get a sense of what government might be interested in, but they're not sort of specific and specified research questions. So in some work we did when we worked, Catherine Oliver and I worked at the Government Office of Science, we actually went back to people who'd written those areas of research interest and asked them because some of them were so difficult to understand. So there was some useful conversation to have with departmental stakeholders about their areas of research interest if they're ones you're interested in. So, for example, if you're interested in a local authority area of research interest in a particular topic, to go back and have a conversation about what would be good research to do in that area. So I think there is what we've described as the kind of start of a conversation, but there does need to be that further iteration to get to a research question. But that is where the kind of researcher kind of skills come in, that actually turning something into a research question is what researchers are trained to do. But it needs to be done in kind of dialogue and discussion a lot of the time.
You highlighted earlier how there is no hierarchy in the different types of evidence. In your experience, what are the best ways to communicate this to decision makers who may be wedded to more traditional formats of epistemology?
Yeah, so I think that's what's so important about the foundations approach that I shared, because that visualizes so nicely from an organization that does, spend a lot of its time with a very particular form of evidence in mind. I mean, a lot of the work they do are around randomized controlled trials and systematic reviews of those trials. So I think it's really valuable to have something coming from that kind of organization, recognizing the different types of evidence that can be used to answer research questions. In work that we've done with policy teams in my current job, but also previously, a lot of it's about really starting with the questions people want to explain. What is it you want to know? And sometimes that's about whether something's effectiveness, and that leads you to a certain set of methods. But often it's about other things. Often it's about whether something is appropriate, whether it's going to be valued, and whether it's going to be useful, what some of the barriers and challenges are. So it's really about starting with what the research questions are and what matters to people, and then from there thinking about the methods rather than letting the methods drive the decisions that we make. And that sounds obvious, but often it isn't the case. Often it is driven by the methods.
And secondly, in challenging financial times, resources can be stretched and research or engagement priorities may change. How can we continue to make the case for building the evidence base in statutory and non-statutory services in financially challenging times?
Yeah, so this is important, isn't it? So I think two things here. One is about recognizing the value of making use of the evidence we have already. So we sit in the UK and internationally on vast amounts of already published, funded research in all types of topic areas. So we've got lots of evidence there already that we can make better use of. And so that is where kind of reviews and consolidations of evidence and briefings can be really useful, and also not just cost effective, but timely. They don't take as long as doing new primary research. And then the second thing I'd say there is this is absolutely where knowledge mobilization comes in more broadly. So let's make sure we don't just fund lots of work, but we really make use of what we've got. We really mobilize that research and make it useful. And so that is critical to the work that things like the Health Determinants Research Collaboration are doing, making sure that we find out what people want to know, and we use the research that's out there already, and we connect with the people who've done that research and just get really good value out of what we've got, and then make sure the limited funding we have for future research goes where it needs rather than duplicating existing work.
Would you have any thoughts or recommendations on bringing informal research opportunities focused on service improvement to pre-existing stakeholder partnerships across different systems? For example, a partnership on a specific topic of work that is looking to bring research into their partnership.
Yeah, so getting these opportunities available to people is really important, isn't it? So quite a lot of these opportunities for practitioners to get engaged in research are there, but they're just not widely shared and made available to people, and that's what's so important. So I think there's more we could do to share opportunities for people to get engaged with a kind of learning and development opportunities. I mean, NIHR as a funder, for example, has been really keen to support people coming from local authority backgrounds in applying for pre-doctoral awards and doctoral awards. There's all kinds of capacity building and placement opportunities out there. So it's just really making sure that we make those opportunities available to people, let people know they're there, support them to put in competitive applications, and that is a big thing that we can do to help. And just making sure those opportunities get to the people who need them, and keeping that diversity and inclusion lens on that. So making sure these opportunities are made available to all, because they can help anyone with the development of their career if they're interested in this kind of area. But some of those developmental awards, like the pre-doctoral awards, for example, I think are amazing opportunities for people to think about developing themselves as researchers, whether they want to do that next step or whether they just want to do some consolidation. The applied research collaborations, so hopefully we're going to have one of those for Pan London going forward. We'll have lots of opportunities for capacity building in the local authority kind of space. So hopefully we'll have that additional resource going forward as well.
I had a project where I had close support from a researcher at LSHTM. It didn't come to fruition because it lost political support at the point of delivery. How can we establish expectations that there may be investment from both sides, but that applications may not come to fruition because of other factors?
Yeah, absolutely. And this happens all the time, doesn't it? So you put all these things in place, and then an extra challenge comes along, like there just not being the support to do it. And that's really frustrating, because it's really hard to get to the position of having, identified a mentor, built a project, and got things, as far along as possible. I think this speaks to this issue that I raised about building systems capability, but also a culture, a research ready culture, which everybody agrees that it's useful for people to do these things for their development. And we've seen definitely in healthcare that where that is the case, that people get to pursue these opportunities and they help them develop on a personal level. But still, even in healthcare, where this has been going on for a long time, people experience resistance from their managers, from their teams, when they've been out to do projects or capacity building initiatives. So I think it's really about building a culture where this is seen as not just somebody having some time off, but someone doing something that's important for the organisation as well as for them as an individual. And I think we've got quite a long way to go to make that a reality, certainly in local government and central government.
Great. I think I've exhausted all the questions in the Q&A button. However, I have a couple that I may proceed with if you're happy. So what are the biggest challenges in embedding evidence use in social care?
So there are lots of challenges to embedding research in social care, and they're not necessarily just to do with the things people always point to, which is around the resourcing in the sector. So not being the finance to allow people to participate. It's just a very different sector. So it's provided by many different types of organisation. So it's not like the NHS where many people are employed by the same organisation. They've got many different organisational formats, different size and scale of organisations, people on different kinds of contracts, people who haven't had much kind of prior education, so it's quite a climb to start to engage with research, and just a high pressure environment as we've got across the whole health and social care system, and also other policy areas such as education. So it is challenging, but generally we found with the partnerships work that we've done, there's been loads of interest in engaging with research and developing capacity. All kinds of different opportunities were available through those partnerships and have had great engagement from those formal things like doing a pre-doctoral award for NIHR through to having a short-term internship kind of or a placement opportunity. So we've seen really great engagement with any of the opportunities that were on offer. But yeah, some of those systems pressures are very significant in social care. Although we really asked ourselves when we started our social care partnership, can this be done here? You know, can we build this in social care, or is it just too hard a task? But we absolutely think it can be done. And there's certainly loads of energy and enthusiasm coming from staff and organizations to be more research engaged.
Fantastic. No questions from the Q&A. Okay. So okay, I think there's a question that have popped up. Let me see. All right. Okay. I'm interested in the particular research skills that are found to be most helpful, important to build in community researchers. Are these skills so directly conduct research or to gain contextual understanding of how research is conducted?
Could you say that again, Pascal?
I'm interested in the particular research skills that you have found to be most helpful or important to build in community researchers. Are these the skills to directly conduct research or to gain a contextual understanding of how research is conducted?
That's a good question. So probably a bit of both. I mean, an awful lot of the work that people are doing when they're knowledge mobilizers is about the skills you need to consolidate other research. Our knowledge mobilizers working in the community often are helping people interpret their own data. So looking at organizational data, for example, so some confidence around using routine data is very useful. But I think probably it's as much about those personal skills as it is about the research, because knowledge brokers are typically really good at connecting with other people with the skills they haven't got on the research methods type side. So if you find a task where someone wants to understand some economic data, for example, a knowledge broker would be really good at going out and saying, who can I find in an organization to help with this, and how can I help explain the answers they give me to the question back to. So it's a little bit like a sort of translation type function. So typically knowledge brokers, people working in the community, they have a great set of skills. Probably the interpersonal skills are the most important, but they're really good at knowing what they themselves know and what they need to go elsewhere for help with. There's some work that's been done in an international group actually looking at the sort of skills and capabilities you need for doing this kind of work, and they've done a really nice sort of performance tool about the skills and capabilities you need to support evidence implementation and knowledge brokering. So there is some work to actually look at what skills you need and how you develop them.
Thank you. I guess we've exhausted all the questions in the Q&A button. It's okay for us to wrap up if that's fine with you. I want to say a big thank you to you, our speaker, Professor Boaz, for sharing your expertise, and thank you to all our participants for your engagement. We hope the session provided very useful insights. The recordings would be shared after the webinar. Some key takeaways for us today: we need to move from linear models to system approaches. Partnerships and infrastructure are critical for embedding evidence. Policy levers like ARIs can drive academic engagement. I want to say thank you to every one of you for your participation, and thank you again, and have a good day. Thank you. Bye.